Governor Kathy Hochul announced a little more than $1 billion in bonuses for healthcare workers. It was described as a way to reward those who worked during the pandemic. But as Natalie Kutchko explains, many in private practices are learning they will not be compensated. Natalie.
That's right, Teresa. So we spoke with two local nurses today of the same private physician's office who say they were looking forward to these reimbursements only to fill out the paperwork and later be told they are not included. Mariah Gerhard and Sarah Mayo spent the pandemic together, treating patients at a local private practice. Nearly 1 month ago, Governor Hochul earmarked a $1 billion section of the state budget as a bonus program for eligible healthcare workers. To the nurses' surprise, they won't be making the cut.
We were open during COVID. We are short-staffed during COVID and still are short-staffed, just like the hospitals are.
Gerhard says employees were notified by HR that private medical and dental practices were excluded, leaving some of those workers wondering why.
When it was announced that it was approved, it didn't specify that private offices were not included in this, pandemic HERO Act. We were through it the entire time.
Governor Hochul said the purpose of the program was to reward, recruit, and retain those in the healthcare industry, with a goal to increase the workforce by 20% over 5 years. Those we heard from say they feel left out.
We sign up to be a nurse to help others. That's what we do. But this was something like a thank you. Thank you for helping us out. Short staff. This is something that we were looking forward to helping our families.
Yeah, absolutely.
Now, as announced earlier this month, the maximum amount a qualified employee could receive was up to $3,000 over 2 vesting periods, those dates beginning starting from October of last year. Those we spoke with today are hoping for a correction from the state. Teresa.
All right, Natalie, thank you. We have reached out to the State Department of Health and the governor's office for comment, and we're still waiting for their responses.